Hepatitis is inflammation of the liver. The liver is one of your vital organs that helps your body to digest food, and it also helps to eliminate waste. If you get hepatitis, your liver cannot function like it normally does, and hepatitis can persist for up to 2 months, or if left untreated, can actually persist lifelong. So there are many different causes of hepatitis. The most common causes are typically viral, most specifically hepatitis A, B, and C. Hepatitis A is transmitted fecal-orally, typically through the ingestion of contaminated food or water. The most common symptoms of hepatitis A include fever, fatigue, headaches, decreased appetite, abdominal pain, diarrhea, and even muscle and joint pains. It can almost present like a mild flu-like symptom. The other types of hepatitis are hepatitis B and C. There's a little bit of difference between these and hepatitis A in the fact that they are transmitted typically through IV drug use or unprotected sex. In addition to the virus that causes hepatitis A, B, and C, it can also be caused by the overconsumption of alcohol, acetaminophen, or Tylenol. Hepatitis can affect anybody. Most commonly, the adults will have much more symptoms than children. Most children under 6 will not have symptoms, or if they do, they will be relatively mild. So until recently, hepatitis A in the state of Florida was not very common. In fact, in 2018, we had about 550 cases of hepatitis. However, in the last year, we have had a quadrupled amount of hepatitis. In fact, we've had over 2,000 cases. There are many things that can increase your risk of hepatitis. These include poor hygiene, consumption of infected food or water, unsafe sex, unvaccinated, and there are other things that can put you at higher risk for having complications. And these include if your age is over 50, if you already have a chronic liver disease, or if you're pregnant. So almost everybody should get the hepatitis A vaccine, especially children once they reach the age of 1, anybody traveling to hepatitis A endemic areas, food handlers, daycare workers, homosexual men, and anybody that currently has any kind of chronic liver disease. Not only is the hepatitis A vaccine extremely safe, it's also very effective. After 1 dose of the vaccine, by 6 months out, you actually have 100% immunity. After the second dose, you have immunity that will typically persist for at least 20 years. There are 3 main things you can do to prevent hepatitis A. Number 1 is vaccinate. The vaccine is very effective. Number 2 is meticulous hand washing. And number 3 is safe food preparation. Currently, there is no treatment for hepatitis A, which is why it is so important to get your vaccine to try and prevent it. If you do get hepatitis A, all we can do is treat you supportively and make sure you get enough rest to allow your body to recover, and this can take several months. There is treatment available for hepatitis B and C. This topic is so important right now because we actually have a state of emergency declared in the state of Florida because hepatitis A, the incidences have just increased 400%. The best thing we can do to try and eradicate this is through prevention, through education, and through vaccination.